Hey everyone, and welcome back to the channel. Today, we're diving into a topic that affects millions of people worldwide, alcohol addiction. It's a complex issue, often misunderstood, but incredibly important to understand. We're going to break down the science behind alcohol's effects, explore the signs of addiction, and most importantly, show you where to find help. Let's get started. What exactly is addictive behavior? It's not just about liking a drink. It's characterized by three key things: compelling need, an overwhelming urge to use a substance or engage in the activity; impaired control, difficulty limiting or stopping the use, even when you want to; continued use despite consequences, persisting with behavior even when it's causing problems in your life. So, let's understand why alcohol can be so addictive. The active ingredient in alcoholic beverages is ethanol. It's a colorless liquid produced by fermentation. When you drink, the ethanol acts as a depressant on your central nervous system. Initially, you might feel stimulated, but as you drink more, it has an intoxicating effect. It relaxes you by depressing control centers in your brain, which lowers your inhibitions. The more you drink, the more impaired you become. Alcohol affects speech, muscle coordination, and eventually, it can cause sleep. Long-term excessive use can damage your liver, pancreas, cardiovascular system, and even affect a developing fetus during pregnancy. Regular drinkers develop a tolerance to alcohol, meaning they need to drink more to achieve the same effect. Factors like food intake, body size, body fat percentage, and gender all play a significant role in how alcohol affects you. It's important to distinguish between alcohol abuse and alcoholism. Alcohol abuse, or problem drinking, involves excessive drinking that leads to health or social problems, but without all the characteristics of full-blown alcoholism. Alcoholism, on the other hand, is a chronic, often progressive, and sometimes fatal disease. It's characterized by preoccupation with alcohol, impaired control over intake, continued use despite adverse consequences, and distortions in thinking like denial. Some signs of alcoholism include drinking alone, hiding alcohol, loss of interest in hobbies, irritability when drinking is interrupted, keeping alcohol in unusual places, intentionally getting drunk, and experiencing problems with relationships, employment, finances, or the law. Most alcoholics deny they have a problem, so often intervention is necessary. If you're concerned about someone, a professional intervention can help them recognize and accept the need for treatment. Treatment is highly individualized. It can involve evaluation, intervention, outpatient programs, and counseling. The goal is to determine the severity of the problem and tailor the approach accordingly. Depending on the severity, treatment might involve reducing drinking or complete abstinence. Programs often include individual and group therapy, educational lectures, family involvement, and the use of counselors. Other approaches like acupuncture, biofeedback, motivational enhancement therapy, cognitive behavioral therapy, and aversion therapy can also be beneficial. For young people, addiction is influenced by parents, peers, advertising, and genetic factors. It's crucial to set a good example, communicate openly with children, and discuss the legal and medical consequences of drinking. Residential treatment programs offer detoxification, medical assessment, psychological support, and psychiatric treatment. Detoxification is a crucial first step, often requiring medication to manage withdrawal symptoms. Recovery is a long-term process that requires ongoing support. Aftercare programs help recovering alcoholics maintain abstinence, manage relapses, and make needed lifestyle changes. Acceptance is key. You can't effectively treat addiction until you acknowledge that you are addicted and unable to control your drinking. Alcohol addiction is a serious issue, but it's not a hopeless one. There are resources available, and recovery is possible. If you or someone you know is struggling, please reach out for help. Don't forget to like this video, subscribe to the channel for more informative content, and share this video with anyone who might need it. Thanks for watching.